So I'm Dr. Virginia Caine, Director and Chief Medical Officer for the Marion County Public Health Department, but I'm also an infectious disease specialist. So I'm Associate Professor of Medicine in the Division of Infectious Diseases at Indiana University School of Medicine. So the Delta variant is a new strain. In this country, is the predominant strain. It is more contagious, meaning that it's more likely to transmit the infection compared to the initial COVID strain everybody was exposed to when this epidemic first occurred. As a result of that particular characteristic, you're more likely to see more hospitalizations related to the strain, and the complications may be more severe. So this is what's so different and unique about this particular mutated strain, because it's not the first mutated strain, it's actually almost our fourth. But this one, for the people who have this strain, we're finding that they have a high viral load. The people who, what we call a breakthrough infection, so they're vaccinated, but they've been reinfected with this Delta virus. And because they have a high virus load in their body system, when they're speaking normally like you and I, they can put these invisible respiratory droplets out in the surrounding air that can remain for, minutes. And so just someone coming and invading that particular space within 6 feet of an individual, they're at a much higher risk for contracting the infection. When we've looked at some different countries like Great Britain, Scotland, that has been very successful, they find that if you are now indoors, because we are not at the level of the vaccination rates that we should be, that in any crowded space, we're encouraging people to wear a mask, whether you're vaccinated or not. Let me just talk about Great Britain and why they were so successful. They had this Delta variant, and they were like, wow, seeing over 200,000 cases a day, and they were having a significant amount of deaths. They were so successful in controlling their epidemic because almost 88% of the entire Great Britain area had received at least one dose, and it dropped down to 73% for 2 doses. And here right now in the United States, we've 70% of Americans have gotten at least 1 dose in, but only 60% have gotten 2 doses in. So it is just so critical that if we're able to wear these masks, it can prevent the spread and transmission of this Delta variant strain to others, and especially of the unvaccinated. And one really important point I need to tell you. If you looked at our hospitalizations in Marion County from January all the way to mid-July, you will find that 98.5% of every patient in Marion County admitted for COVID-19 were unvaccinated. So it's our unvaccinated individuals, residents, who are so vulnerable to these hospitalizations, more severe complications, and we now seem to see a younger predilection of these cases in a younger population than when we first started with this epidemic last year. So we're now seeing young adults being hit by this. Even pediatric children can contract this and in intensive care units. So we really want to make sure also we're protecting our children who are not eligible to get the vaccine. So anyone 11 years and under, they can't get vaccinated. So I think one of the things is that it is so critical to look at the information and look at the science and try to look at the source of your information, because it's unfortunate. You know, we're in this social media world, and so anybody can put a message out that's incorrect, may not have a medical background in putting this message out. So look to see if you have a trusted healthcare professional that you are interact or involved with. I think they're a key person to look for information. I'm a strong supporter of information coming from the Centers for Disease Control and Prevention, but your state health departments, your local health departments, your academic facilities, your hospital systems, or have some wonderful information out there. And we just have to continue to listen and understand the consequences that may occur by being unvaccinated. A vaccine is usually mild side effects. You know, they are safe, very effective. We have one of the most rigorous scientific medical approaches, and we've been building on this research for years. So anyone may have a car out there. Do you know when these new cars now with the technology, you know, the safety that's built in and whatever, it didn't happen overnight. So this vaccine is not some new vaccine that's happened overnight. It's been built on new technologies, new gains in thresholds over time for it to be one of the best vaccines ever we have had in this country. I think the most powerful tool we have to get our community back to almost normal pre-COVID-19 before anybody heard about it is to get vaccinated. And remember how important and critical it is to protect our children and our loved ones, friends and colleagues. See if you can do the right thing, and always be conscious of the information that you're getting. Please listen, continue to read, and stay abreast of any new updates that may be occurring in our community and across our country.